Welcome back to another week of my life as a veterinary student. I am starting this vlog off on a Tuesday. I wasn't feeling too good yesterday, so I just decided not to vlog. Yesterday, all I had was 4 hours of lecture, and that was it for the day, and I studied in the evening like I normally do. But today is my first time doing the companion animal rotation. So I will be doing that until Thursday this week, and then on Friday I have my professional development communications lab. I wanted to share another round of clinical rotation with you that we get here at SGU. I am running a little bit late to head to class this morning. I technically have 4 hours of lecture, but I'm only going to 2 lecture hours because the last 2 is my professional development class, and it is optional to go to those. Instead, I just want to focus on making sure I am prepared for my rotation this afternoon. For the companion animal rotation, we go in at 1:15 to 5 o'clock at night. So it's not too long of a shift. It's going to be pretty exciting. I'm looking forward to the patients we have coming in today, but I will discuss that a little bit later since I do need to get to class now. If you do enjoy this video, please give it a like and subscribe for more, and I hope you enjoy it. Class today went pretty good. I had an hour of equine internal medicine today where we covered topics in neurology for horses. And then in livestock medicine, we talked about respiratory diseases. I'm pretty sure we're going to cover neurology and respiratory for the entire week for livestock species and horses. I did go ahead and get ready for my shift that is about to start in a half hour, but for my appointments today, I have 3 pretty much vaccine appointments. I think there's 1 appointment that is for increased urination, and we're just checking in and following up with the client to make sure that the patient is doing better today. I'm super excited for one of the appointments though, because we get a cute puppy to deal with. I will check in with you guys after I get back tonight, and hopefully today goes well. I am back from my shift and it went pretty well today. I thought it was a good first shift. For our appointments today, the first one was just getting a booster of the distemper lepto combo, and then our second case was a lot more interesting. We were trying to figure out why this dog had increased urination and why he was straining a little bit. So we got to do an ultrasound today. I got to do the physical exam on that one and actually felt an enlarged bladder, which was pretty interesting because I haven't really felt that before, and he definitely was not a fan of it either because obviously he was in pain. So we were able to give him some pain medications. We did have to sedate him to do the rest of the exam just because he was so painful, but it was interesting to catch it finally. After that, we did do radiographs on him and actually did a rectal exam and found that his prostate is actually enlarged. So we ended up putting him on some pain medication to help with the discomfort until he can be scheduled to be neutered. It was an interesting case, and then with the last appointment, I wasn't able to go in and see the patient because it was a rescue case, and the more people that were in the room, the stressed out the patient became, so we just limited it to 2 students and 1 professor, so the dog wasn't too overwhelmed. I heard it was a very adorable puppy, so I'm hoping he is doing good. I believe all he came in for was to double check a lameness issue and also to get vaccinated. Overall, today was a pretty good day, but now I do need to get back into studying because we are getting close to moving off the island. Like, it's crazy. Our finals are not that far away. Even though we just finished midterms, our final exams are coming up in about a month, so it's honestly closer than I think, and there is a lot for me to do. I'm gonna go ahead and get started with studying and keeping up on my material and making sure that the medical records from today are completed to the best of our ability. That's what the plan is at the moment. It's almost 9 o'clock, so I am going to go to bed shortly, but just kind of wanted to talk about what my plans are for tomorrow. I have 3 hours of lecture in the morning, and then I do have my companion animal rotation tomorrow afternoon. Normally with rotations, I'm so tired that I usually can't focus on my lectures the next morning. I am really happy with how today went, though. Like, I feel like I'm starting to finally get the hang of the physical exam on a dog. I was actually able to palpate something abnormal today, which was not good for the patient, of course, but it was unique to see, like, I can actually identify abnormal stuff now. And it makes me feel a little bit more confident in my skills. There are a couple of things I still need to work on, though, that I noticed during my physical exam. I found that there was an incisor missing, and I didn't know which tooth it was. So I actually spent some time this evening reviewing canine teeth and the numbering system for it, because at some point I'm sure I will be doing a dental, and it's important to document which teeth are missing, especially if it's the first time you are seeing the patient. So I definitely want to get better at that. And during my physical exam today, I also didn't realize that the ears were inflamed on the dog. I thought it was normal, but the professor and another student said it was abnormal, so I definitely want to get better at that. Thankfully, they didn't really see any bacteria on the slides after we took a cytology sample from the ears. There's still plenty to learn, and I am definitely working on honing in my veterinary skills. I felt like today was very successful, though, and I'm hoping that tomorrow is another successful day. We have another vaccine appointment for a dog. It's actually a puppy, so it's getting its booster for distemper and lepto. And then we do have an elderly patient coming in to do a wellness exam, I believe, just to do an overall health check, because we haven't seen the patient for about a year, and it's nice to check in on our older patients to make sure that they are doing well at home. And for the third appointment, I'm pretty excited because we have this adorable kitten coming in tomorrow that actually belongs to one of our classmates. So I'm looking forward to seeing the kitten because I'm assuming it is going to remind me a lot of my previous cat. Other than that, I did prepare for tomorrow's appointments. I made sure to put down all of the notes that I think are super important. I will see you all in the morning. I just got back from my shift at the small animal clinic, and today went pretty good. Class this morning was pretty slow. I had actually an hour off from no lecture because they just happened to put an hour time slot that had nothing in it. So we had to wait an extra hour to finish off our lectures for the day, so we still had to stay the whole time. We just continued on the topics that we started discussing yesterday, so really nothing new. Our appointments went pretty well today, but one of them was a no-show, and then our second appointment actually brought in 2 pets. So we did a physical examination on both and got their vaccines done. And then for the cat appointment, we didn't actually end up seeing the cat because we were taking so long with the 2 pets that came in. Overall, it was a good shift. For the rest of the night though, I think I am going to go out for a little bit and get some drinks and get some food because I don't feel like eating what I have here at the moment. So I'm just going to go ahead and grab some food at Container Park. That's just kind of the plan at the moment, and then I'm gonna come back and study for quite some time because I need to do some post-reviewing on the classes that we had today. It's going to be a nice, chill night. Today went pretty well. Even class this morning went pretty good, but I did come home after the first 2 hours because I wasn't feeling too good today. I was just in a little bit of pain, so I figured I would just come home and rest up before my shift this afternoon, and I was able to take some medication to help myself feel better before the shift today. And we had 3 cats come in for appointments, and all 3 of them did really, really well. I even got to do some vaccines on one of the cats today, and it was pretty exciting because I don't have a lot of cat experience, so I've been working on getting some more. Our last case, we did end up doing some blood work, and it turned out that the cat was anemic, so we'll have to do a recheck in about 6 to 12 months. Our last patient was kind of interesting because it actually turned out positive for FELV and FIV, which are some conditions that can be seen in cats that we talk about a lot in class. And on the screen here, I'll try and explain kind of what they are in simple terms, because it's very interesting that we finally get to be able to diagnose these conditions. It's not super good for the cats that have them or the clients that own these types of pets. It was definitely a nice rotation. I did like it, but I do kind of miss the fast-paced areas of ambulatory and surgery and anesthesia. Those were very fast-paced. I think it was kind of nice to have this rotation right after we had our midterm exams, so I do appreciate the scheduling for our group. Next up, I do have a week of ambulatory coming up again, and this time we will be working on pigs. So I'm pretty excited about that because I have not touched a pig since the University of Findlay during my undergrad years, and that was a long time ago now. So I'm looking forward to getting some more experience with pigs. So if you do want to see that video will be up in about 2 weeks' time after doing my ambulatory rotation. So if you do want to see that, be sure to subscribe to the channel. We are not quite finished yet with our school week. I have another full day of classes tomorrow, and then I also have my communications lab in the afternoon. Then after that, I have to come back home and get ready for a birthday party that I am going to be attending. Tomorrow is going to be a very long day. We are actually going to a restaurant that I've never been to before on the island, so I will definitely be sure to let you know how that food is. But tonight, I think since I'm still not feeling the best, I'm going to take it a little bit easier and not burn myself out too much. I do want to practice for my communications lab tomorrow, just to go over the scenarios that we will be doing. It's definitely been a long day. Good morning, it is finally Friday. It is the end of the week, and I actually decided to stay home today from classes just so I can rest up before my communications lab this afternoon because I'm still not feeling the best. I figured just to make sure that I'm not contagious or anything, I will stay home from class today. I don't think it's contagious because I feel like it's my other health issues going on. I still plan on going to the birthday party tonight. This morning after I woke up, I decided to get some coffee and also a plain croissant just so I can eat something because I haven't really been hungry in the last 2 days. So I don't really know what's going on. Since I am deciding to stay home this morning, I am going to go ahead and do my laundry and some dishes and also get some of my schoolwork done and prepare for my communications lab this evening because last night I just completely took off the night from studying or doing anything school related because I was trying to make myself feel a little bit better to actually go to class this morning, but that didn't really happen. I'm gonna go ahead and eat my breakfast and then get started with my day. Slight change of plans today. My landlord kind of needs me to be outside of my apartment today, so I am going to head to class actually. I have about an hour to get ready. They are resurfacing my walkway today into the apartment area, so I won't be able to walk on it until like 5 o'clock or 6 o'clock tonight is what the landlord is saying. So I do have to be out of here all day. It's fine. I will make do. I will bring all of my medication with me. So hopefully I don't have an issue today. It could be worse. I'm not like super sick, so it's fine. I just made it back from campus. It was a very long day. As soon as I was told to vacate my apartment this morning, I went to class as planned, but the air conditioning in David Brown Lecture Hall was not working today, so it was a sauna in there, and the first professor just lectured through that. Our second professor, though, decided to switch lecture halls to Ray Jan Sis, which, funny enough, is actually supposed to be the vet school lecture hall, but it can't hold all of the students. So it was nice to finally be in our actual lecture hall for the first time, and probably the last time. I wish we had lectures in there, but unfortunately we are just too big of a class to fit. So I don't know what their plans are for the incoming students because they are double the size of what we were. Classes went pretty well. We did a lot of cases today, so those are always pretty helpful, especially when it comes time for exam season because those are actual live-based scenarios, which usually our test questions are over. Then I had to wait on campus until it was my communications lab, which I thought it went pretty good. The professor thought it went really good. But the client, the pretend client, thought it was awful. So, I don't know. I really don't know how to feel about that. I thought her feedback was pretty harsh. But it is feedback. So, you just take it with a grain of salt. These scenarios sometimes aren't actually real life things that have happened. Yes, we will be dealing with angry and grief-stricken clients quite often, but maybe not in the same way that these cases were presented, because some of the scenarios I've never seen happen before, but doesn't mean it can't. It was good to practice those. I got to deal with the grief-stricken client. But now I'm finally home, so I am going to start getting ready to go out to the birthday party tonight. But it is finally the end of a very long week. I cannot believe how much has happened this week. I also signed for my apartment in Virginia today. So that was good news. I managed to change one of my externship dates because Virginia, Maryland sent me a nice email yesterday saying I had to switch some of my externship dates to meet their requirements. So I'm still waiting on the last externship to confirm whether or not I can change dates. I don't know. It's been kind of a good week, but it's been frustrating in some ways. I am going to end off the video here. I do hope you enjoyed this week's video. If you did, please give it a like and subscribe for more. And I will definitely show you the video clips from this evening right after this part, so stay tuned for that. I hope you all have a great weekend, and I will see you next time.